to our second part of fundamental and derived positions. We have studied in the last class about the fundamental positions and derived position of standing. Now you will see a video on derived positions of standing. We have already discussed about the different derived position. Now Raj will demonstrate for us different derived position from standing. So standing by alteration of hands. Okay, so wing standing. See, this is wing standing, and bend standing. This is bend standing, and yard standing. This is yard standing, and in front, if you keep your hands in front, it is reach standing, and if you keep your hands up, it is stretch standing. Okay, so these are the derived positions from by alteration of the arm: wing standing, bend standing, reach standing, yard standing, and now by alteration of the legs: toe standing, standing on the toes; stride standing with wide base of support; and walk standing, one leg in front of the other as like we are walking; and half standing, one hand, keeping one hand up on the stool or on small stool or large stool, wherever it is. You are keeping your weight fully on your one leg. So that is half standing. So again, now toe standing, stride standing, walk standing, and half standing. These are the derived positions of standing by alteration of the legs. Now by alteration of the trunk, it is stoop standing, and other one is lag stoop standing. Is it clear? Stoop standing and lag stoop standing, completely bending down. Okay, in stoop standing only on hips. Now we will discuss about the derived position from kneeling. The position of the arms are the same as in standing, and we added to the kneeling position as required. Half kneeling. One knee supports most of the weight and the other leg is bent to the right angle at hip, knee and ankle, so that the foot is supported on the ground in a forward direction. This position is similar to the step standing and may be modified by stretching the forward leg in sideways direction. The pelvis is well fixed. And the next one is kneel sitting. In kneel sitting, knees and hips are flexed so that the patient sits on his heels. Sometimes used for small children, but most people find it very uncomfortable. Next one is prone kneeling. The trunk is horizontal, supported under the shoulders by arms, and at the pelvis by the thighs, which must be held vertical. The head is held in line with the trunk. The position is stable, comfortable, and suitable for many trunk and head exercises. Pelvis is free for anteroposterior and lateral movement, but fixed for rotation. Body may be inclined forward and downwards by the abducting the shoulders and bending the elbows. This expands the thorax and localizes the lateral flexion to the thoracic region. Now we will discuss about the derived positions from kneeling. Guys, please go on to the kneeling. This is kneeling position. Okay, so half kneeling. One leg is on kneeling position and the other leg is bent forward, kept bent forward. And kneel sitting, the kneel position and sitting on the legs. And now prone kneeling. This is prone kneeling. Okay, on your fours, on your knees and hands. Is it clear? Once again, that will show you kneeling, half kneeling, kneel sitting and prone kneeling. Now we will discuss about the derived position from sitting. There are many, like as in standing. Okay, straight sitting, right sitting, crook sitting, long sitting, cross sitting, side sitting and high sitting. Okay, so now we will go one by one and Raj will demonstrate you after that. It's very easy, right? The first one is straight sitting. This is exactly similar to the fundamental position, except that the legs are abducted so that the feet are 2 foot length apart. It increases the stability of the position, especially the feet is pressed on the floor. Okay. And the second one is right sitting. The patient sits like riding on the horse. Okay, that's called right sitting. And the next one is crook sitting. When sitting on the floor, the knees are bent so that the feet are together and flat on the floor. So the knees may be together or apart. It's called crook sitting. It is used in treatment of kyphosis, as the movement can be localized to the upper trunk and increases the strength of the back extensors. The next one is long sitting. This is similar to the previous position, but the knees are extended so that the whole leg is supported. It leads to increased tension of the hamstring and position is very difficult due to instability. Okay, the next one is cross sitting. Cross sitting is similar to the crook sitting, but the angles are crossed and the hips are strongly abducted and laterally rotated. It is used for children during the head, arm and trunk exercises, as the pelvis is fixed and stable. The next one is side sitting. For side sitting, one leg remains as in cross sitting and this supports the main weight of the trunk while the other is abducted and medially rotated. The pelvis is laterally shifted to the left. It increases the lateral mobility of the lumbar spine. Next one is high sitting. The sitting position is taken on a high plinth or a cable, but the feet remains unsupported. It is useful and convenient for the foot and knee exercises. Now we will discuss about the derived position from sitting. Okay, let's sit down. Okay, sit properly behind. Okay, only 2 to 3 centimeter from your knee. The distance should be from your sitting area and your knee should be only 2 or 3 centimeters. And back should be supported, but we are just doing it on the bench as we need to do other positions also. So this is the normal sitting. Now he will show you stride sitting. Stride sitting means like as we did it in stride standing, we are just keeping the legs apart. And ride sitting, like we are riding on the horse, ride sitting. Okay, and crook sitting is doing by bending the knees. And next one is long sitting. Okay, and cross sitting down. Just face forwards camera. Okay, this is cross sitting and side sitting. And we have one more sitting called high sitting, sitting on the desk by hanging the legs on the floor. Okay. Next one is positions derived from lying. The same as in standing position, the muscles work is modified and usually reduced by the horizontal position of the body. The first derived position from lying is crook lying. From lying, the hip and knees are bent so that the feet rest on the floor or plinth. Very little muscle work is required for this position, and it is used to train the relaxation and posture and in pelvic and back exercises. Next one is crook lying with pelvis lifted. For this, from the previous position, that is crook lying, the pelvis is elevated so that the trunk rests on the shoulders and is brought into line with the thighs. Okay. Next one is half line. In this, the trunk is supported in the oblique position by inclination of the long end of the plinth or by arrangement of the pillows in which the legs are supported horizontally. It is important to see that the trunk is in alignment to avoid slumping of the body. Next one is prone lying. Lying facing forwards, the body is fully supported anteriorly on the plinth or the floor. The position may be active or relaxed. The next one is side lying. You are lying on your side, right or left. Details of this position vary considerably according to the purpose for which it is used. The next one is sit lying. The patient lies supine with the knees bent at the lower leg. Okay. There is a tendency for lumbar region to extend owing to the tension of the hip flexors in this position. It is a very difficult position due to hyperlordosis of the lumbar region. Now we will discuss about the derived position from lying. Lying means as in standing, you are horizontal on the floor. Hands are kept on the sides and legs are together and spine is straight, head and neck is straight and everything. So the derived position from lying is crook lying. Bending both knees, lie down and bend both knees, lying in the same position and bending the both knees. This is crook lying. Crook lying with the pelvis lifted. This is crook lying with the pelvis lifted. And half lying. Half lying. Then yes. This is half lying. And sit lying. Next one is sit lying. Come front. Yes. And lie down. This is sit lying. And next one is side lying. Side lying on the side. And another one is prone lying. Prone lying. Okay. These are the derived positions from lying. Now we will go to hanging. Next and last one is position derived from hanging. Full hanging. The body is supported in the oblique position by the arms which grabs on a horizontal bar, and by the feet, while the rest of the body is inclined and straight. Hanging. Just keep your hands up. Yes, this is hanging position. The feet will be up. Okay, thank you, Raj.